And welcome back. Well, joint pain and chronic injuries can affect a lot of people. So whether you're an elite athlete or a weekend warrior, thankfully, there's a place close by that provides medical and surgical help.
Join me on a tour of Orthopedic Associates of Wisconsin in Pewaukee. A lot of people have probably noticed this big, beautiful building from the interstate and wondered what goes on here. It's all so beautiful on the inside. Can you give us sort of an overview of what you do here?
Sure. This clinic, which we're very proud of, opened up about 3 years ago, and it's all orthopedics. It's a clinic that under one umbrella has obviously patient care and evaluations for injuries. Even we have now a walk-in for orthopedic acute injuries. This facility houses patient care from an evaluation, surgery. We have 17 orthopedic surgeons. We have imaging that includes regular X-ray, MRI. We have rehabilitation, physical therapy here, all under one roof, which makes things very convenient for the patient. But when everything is in one spot, it's easier, and we're kind of a big family.
And I'm fascinated to know through the years what you've seen. What are some of the new trends in orthopedics?
A lot of the new things are in pain management and anesthesia and the type of what's called regional blocks that they do, that traditionally that people would wake up with a lot more pain than they do now. There are certain nerve blocks that can be done to really help with post-operative pain management. In terms of joint replacement, they're lesser invasive. People are going home either same day or the next day, and that's because of the newer techniques. Transparency is also something we like to be proud of, and if people want to know the, compare or want to know the cost, that they can do those comparisons. And I think that they'll see that we rank quite well in terms of trying to deliver really quality care, yet keeping the costs down.
It used to be that people would have to wait such a long time to see, especially an orthopedic surgeon. It's amazing to think that any day of the week, including Saturday mornings, you could be seen right away.
Right, well, we've worked hard to try to accommodate people because everyone's schedules are so busy and they don't want to wait a long time. So we have so many different providers here that we're able to accommodate people in that regard. And I think they really appreciate having that access, and it's worked out very well. In
terms of sports-related injuries, I bet that's a lot of the types of patients that you see here.
We see a lot of sports injuries. And when we say sports injuries, it's a very broad category. That could be for somebody who's an elite athlete, or that could be someone who's just a weekend warrior. Anyone who's doing something active, we consider sports injury, and that's a huge percentage of what we treat.
What kinds of problems do you treat that you would consider to be sports related?
Well, starting from the top of the body going down, a lot of shoulder injuries, overuse injuries from throwing athletes, shoulder dislocations, any sort of chronic shoulder pain, that's going to fall usually into the sports medicine realm. Then I'm going to skip down to the knee, which I see a lot of, and so we see acute injuries such as fractures, ligament tears, soft tissue injuries inside the knee called the meniscus. We see a lot of torn meniscus injuries. We'll also see arthritis of the knee, which can present as a sports injury. If somebody is a little bit older and they're participating in some sort of activity, the pain from arthritis can come on while doing sporting events. But probably the most common sports injury I run into is going to be an ankle sprain. And those can range in severity from very debilitating crutches to just kind of limping a little bit. And that we see in all age groups with almost all activities, even if it's just walking the dog to playing high-end basketball or football. The ankle is at risk of a sprain, and we see those patients usually right away and try to get them set up in therapy and try to get that ankle feeling better and get that person back to their activities as soon as possible.
And I always wonder how you know when you need to see an orthopedic.
Well, sometimes it's hard to know because you don't know if you broke something, you just sprained it, or if it's just a bruise. So whenever there's any question, I think it's a good idea to come in and be seen with an X-ray, because without an X-ray, often it's impossible to tell if someone has a sprain versus a fracture. If you get to the point where you can't do what you want to do anymore, if it's keeping you up at night, those to me are red flags that you should have that looked at, and hopefully we can do something to make that better. Of course, we have the acute traumatic injuries where something's pretty dramatic and painful and they need to be seen and taken care of. But the other, I would say close to half, is just people whose quality of life is not what they want it to be due to whatever injury or nagging issue they have, whether it be in their upper extremity, their lower extremity, or their spine. Our goal is to get their quality of life better.
So to connect with Orthopaedic Associates of Wisconsin, you can schedule an appointment by calling 262-303-5055 or online. You can go to orthowisconsin.com. They are located on Gulf Road in Pewaukee. We'll be right back.